Hello, everybody. This is Dr. Myckatyn from. Hello, everyone. This is Dr. Myckatyn from West County Plastic Surgeons of Washington University. Just going to get a bit better light here. Um, Welcome. Today we're going to be doing a Facebook Live on facelift surgery. So some of the basic concepts related to that. So facelift surgery, plastic surgeons often call that rhytidectomy. Um, there are a couple important things to know. One is kind of why somebody would consider doing a facelift versus doing some of the many non-invasive interventions that we have these days to try to provide a more youthful appearance to the face. And then we'll also talk about some of the variations of the facelift, and then also what some of the supplemental procedures can be in addition to that. So, without further ado, um, so why would somebody pick or choose to do a facelift in the first place? So, essentially, a facelift is a surgery that is performed. It can be done under local anesthesia, sedation, often under general anesthesia as well. And in a facelift procedure, essentially what's happening is there is an incision which is being made in front of the ear, and then the skin of the face is being lifted up. In a short scar facelift, typically the incision is coming just in front of the ear, and that's it. However, more standard facelifts or facelifts that are combined with neck lifts will also see the incision curve around behind the ear up into the hairline. And there's multiple variations on the incision length that can be performed, largely based on sort of what type of skin excess the patient may have and what their goals are and what we're really trying to improve or address. So compared to something like Botox, so Botox would be used to deal with creases, often in the forehead or around the eyes, sometimes in the lip, and in some other areas. Um, Lasers can be used to smoothen out finer lines and some deep lines around the lips, improve the skin texture and quality overall, along with skincare products and facials. Um, and then there are also other procedures, something called Ultherapy, which is a non-invasive device that can be used to use focused ultrasonic energy or ultrasound energy to tighten up the collagen or the proteins in the skin and tighten up the face that way. Um, all of those procedures have some effect. The Ultherapy does create some skin tightening. The Botox is very effective for removing wrinkles for 3-4 months. And skincare can definitely improve the overall skin quality, discoloration in the skin, and such. However, facelifts are sort of going after a different sort of set of concerns. So, with a facelift, we're doing those more for people who have a lack of contour or lack of definition of the jawline, more prominence of these nasolabial folds, descent of the soft tissues of the face, creating more of a sort of a triangular shape versus this sort of more youthful shape. Facelift is also very effective when coupled with neck lift to reduce some of the lines or some of the obliquities or the non-angular contours of the neck as well. So it's going to be a more powerful procedure than Ultherapy. Facelifts can often be combined with fillers, with fat injection to improve volume as well in a more powerful way than fillers themselves can be used. Of course, the downside of that more powerful procedure is that you're having general anesthesia, but the results from facelifts tend to also last longer as well. So, in terms of the different styles of facelifts, um, all facelifts involve some redraping of the skin. So, removing some excess skin and then pulling that back and tightening it. But it would be a mistake to think that what we're trying to do in a facelift is essentially grab the skin and pull it back really tight. That can kind of create almost a look like you're in a wind tunnel or something, and that's not what we're going for. Rather, what we're trying to do is just reset the skin to a more youthful appearance. But in addition to doing that, there is also structural support in your face, which is the layer below that, which plastic surgeons call the SMAS, or the superficial myoaponeurotic system. And this is essentially a connective tissue layer that's below the skin and the fat of the face, which runs across the face. It covers up some of the fat pads of the face, and then it runs into the thin sheet-like muscle in the neck called the platysma. And above the cheekbone area, it also runs into a connective tissue layer called the temporoparietal fascia. And so it's this structural layer which plastic surgeons are often trying to lift or tighten in order to give a more long-lasting facelift effect. So you'll see a lot of facelift procedures that involve either over sewing or tightening up that fascia of the SMAS, or removing a piece of it and lifting it, or reorienting it in some way. And so the extent of facelifts often is determined by the degree to which we're manipulating that SMAS layer. So that's sort of a sort of an overview of what we're doing with the facelift. Once the SMAS is manipulated, the skin is removed and redraped and sewn up. Oftentimes we do use a drainage tube in facelifts, and we use some compression as well to kind of help contour the face. We may also choose to do some other procedures to complement the facelift. So that can include injection of fat. So for example, adding fat into the mid-face layer to try to help along with the facelift to sort of bring up the fullness up more towards the cheeks rather than lower in the face. It can also include addition of fat to the what's called the nasolabial folds, or to these pre-jowl triangles, or these areas where there's depression in the central face. Often we'll also use eyelid surgeries to rejuvenate the eyelids at the time of a facelift. So this can include doing upper eyelid blepharoplasty, or removing some eyelid skin, lower eyelid blepharoplasty, either to remove fat or improve contours or to tighten the skin in those areas. And then oftentimes also some form of brow lift procedure as well. That can be a brow lift where we make small incisions and use a camera or an endoscope to try to smoothen out some of these lines and to provide a little bit of elevation of the brow, or a more formal open brow lift where we do a more dramatic elevation of the brow. And there's other variations as well. So brow lifts, blepharoplasties, fat grafting often accommodate or accompany a facelift procedure as well. Now, so what are the downsides of doing the facelift? So those are the fact that there is this scar, and different patients will have different tolerance to that. So certainly men and women who wear their hair longer can often conceal that scar fairly easily, so it's not as big of a deal. Women who wear their hair shorter, or often men who wear their hair shorter, that is more of a consideration. Certainly we work very hard to try to conceal those scars and place them in natural creases on the face and in areas that are less conspicuous. In addition to that, of course, there is oftentimes either local anesthesia or sedation, or very often general anesthesia to do a facelift procedure. So that's something that one is to consider when they're going to have a facelift procedure as well. There's also going to be more downtime with a facelift than there would be with an injection or a laser or Botox, for example. Now, I do think that we've had a lot of opportunity to innovate and improve our approach to facelifts. So things like enhanced recovery after surgery protocols, using certain medicines to reduce bleeding and swelling, just alterations in our techniques have all, I think, served to reduce swelling and bruising with facelift surgery. So I do think it's a procedure that can be done and incorporated into somebody's busy lifestyle better than we've been able to in the past. Yeah. So those are some of the basics on facelift surgery. And certainly, if you would like to learn more, we'd welcome you to visit our website at www.westcountyplasticsurgeons.wustl.edu, or please make an appointment and see us. Our phone number is 314 996 8800. Certainly, we can do that in person. If you're coming from a bit of a distance, or if you'd like just to talk, we can certainly do that also using telemedicine or video conferencing as well. Again, thank you for your time. I hope you stay safe and that you mask up during these trying times for our society with the COVID-19 pandemic. And I wish you and your family health and happiness as we get into the holidays. All right, have a great day. Thank you very much.